I have a lot. Okay, perfect. Thank you, Imran Ali. So let's start. Let's start our today's class, and it starts with the last part of this. This that is chat. Okay, so we start with dental nomenclature. It's very easy. This part is very easy, and then we'll go for the history and physical examination part, which is very important, as it will also allow you to revise because hospital for your clinical rotation, and you will have to do this almost every day, which is history taking and physical examination. If you are serious enough to learn, then now is the time. Okay, first we will finish with dental nomenclature. Okay, so by dental nomenclature we mean to number or to name or to give some kind of name or number to the our teeth, so that we can later on recognize these teeth by numbering or naming them. We already know that there are four types of teeth, namely incisors, canines, premolars, and molars, central and lateral. Incisors and canines only we have one pair in the upper jaw, one pair in lower jaw, and then premolars and molars, right? So, and this is the upper dental arch, lower dental arch. Now we see a method or to name these teeth, so that, for example, if someone's teeth is have some disease, so now we have to name, okay, this teeth is number this and that, and then we have to take the radiographic examination, x-rays, so that there is no misunderstanding of which teeth is in, if a tooth has a problem. Okay, so as you see the left side, we have a jaw, the lateral view, and upper and lower jaws. This is upper because it has palate, hard palate, bony palate, and then this is lower jaw, and these are the teeth in the socket in the alveolar bone. So the maxilla consists of two bones forming the upper jaw. These bones are rigidly attached to the skull. So the maxilla have two bones which are known as palatine process of maxilla, followed by this suture. The mandible is a horseshoe-shaped bone which articulates with the skull by the way of temporomandibular joint. So this mandible is a horseshoe-shaped bone which articulates with the TMJ. So this is horseshoe, and then this is articulated with the TMJ here. Excuse me. Okay. Temporomandibular joint. So temporal region and then mandibular region makes a joint known as temporomandibular joint, TMJ. Okay, perfect. So the upper arch is called the maxilla. This all the things are revising again and again, so we'll take less time for over this. So the upper arch is called the maxilla. The teeth in this arch are called upper or maxillary teeth, and the lower arch is called mandible. The mandible bone is making the lower arch. The teeth in this arch are known as lower or mandibular teeth. Each dental arch has a midline here, here, that divides into equal right and left arch. So these, the midline they are talking about is an imaginary line which will divide. Oh, this is a little off. So which will divide it into right and left halves, and these right and left half will be known as quadrants. Each dental arch has a midline that divides into two equal right and left segments named quadrants. There are four quadrants. Okay, let's see. So we have four quadrants. There are four quadrants in the oral cavity: maxillary right and left quadrant, and mandibular right and left quadrant. As you know, maxilla is on the top, makes upper jaw. So we have upper right quadrant, upper left quadrant, and then mandible lower left and lower right quadrant. So from upper side we start, quadrant number 1 is upper right, quadrant 2 is upper left, and lower left is quadrant 3, and quadrant 4 is lower right. It's okay to confuse these, doesn't matter if you just say upper right quadrant, upper left quadrant, or right maxillary quadrant, or it's the same as long as you pronounce it correctly. And then we have lower right, which is mandibular right, and lower left, which is mandibular left quadrants. So easy, nothing out of ordinary. So now we have a tooth identification system where we name the teeth or number, give a number to teeth so that we can recognize it in our clinical practice. Tooth identification systems are tooth numbering or tooth coding systems. There are two such systems commonly used worldwide. So we are talking about the common systems commonly used. Okay, one is palmar notation system and one is universal system. Here you can see in the picture on the right side, we have a palmar, this system, and then universal is this purple. Yeah, so let's see what it is. How to take you to a safe place. Okay, so palmar notation system for permanent teeth and deciduous teeth. For very easily, I can first, let's just go for the permanent teeth. So starting from the midline, if we take a midline of the upper jaw and lower jaw and divide it into left and right quadrants of maxilla and mandible respectively, upper and lower, then from the incisors, central incisors, we can start name 1, 2, 3, 4, 5, 6, 7, 8, and same on the left side, 1, 2, 8. Same in the lower jaw, we have starting from the central incisors going towards the lateral side, 1 to 8, and then 1 to 8. So when we have this kind of lines below the number or above the number, this means it's palmar. This is palmar. So if we have, let's just 1 and this, it means right quadrant 1, upper quadrant, right? This one, this area is free, so upper quadrant, and it is covering here, so right. And then this is used for left. How to remember? This has L is for left. So whenever there is a number, for example 3, and this line, this makes an L, so left quadrant. And because on the upper side, upper edge, it's free, so it is upper jaw, left quadrant, third teeth, which is upper left canine, right? So it's easy. So, and for the lower, the number will be free from the lower side. It will be free. The boundary will be on the upside, and then this will be opposite. So if upper side L is like this, then lower side will be like this. So you just remember the left quadrant. Remember the left quadrant, L left, and then others will follow. So if there's a number like 4, right, and we have like this boundary, so now this is opposite to L, the left, mirror image of an L, right? And it's lower from, it's free from the lower boundary here, right? So now you can say it's lower jaw, lower from, if free from lower boundary, lower jaw, and then is opposite to mirror image of an L, fourth left quadrant, which is, this is central incisor, lateral peripheral incisor, canine, and then first premolar. So this is first premolar. Okay, so this is for the permanent teeth. Now if we go back to the primary teeth or deciduous, A to E. So for baby teeth and milk teeth is from A to E. If this is the midline, if this makes the midline, so same L for left, and then this one will be right. So if we have a boundary in the left region, or you can say, okay, so it is closed from the left side, and it looks like the number is on the left side, right? So this is left quadrant. And if it is closed from the right side and number looks like on the right side, then it's the right quadrant. So another way of remembering this is, we have four notations, right? Like this, and then this and this, right? So this makes a pipeline, let's just say. Okay. No, like this. Yeah. So these are the right quadrants, and this one the left quadrant. These are the right quadrants, and these are the left quadrant. Because in this, the number or the figure or the alphabet is on the right side and it's closed on the right side. So this is right quadrant. And because it's open from above, so upper quadrant. So upper right quadrant, closed from the right side and open from the above, upper right quadrant. Closed from the right side and open from the below, lower right quadrant. And same goes from this, that if we have C and C here, it's closed from the left side and closed from the left side, it's upper side open, so upper left, and then lower side open, lower left. And this right and left is for the patient's right and patient's left, not yours, right? So that's a way to remember this. You can make your own how you say way to remember it, but you need to remember these two notations. One is Palmer and one is universal. Okay, so if we have a midline from here, then A to E is for the deciduous, the left quadrant and right quadrant, and same for the lower jaw, left the denotation. Okay, so here we have permanent teeth and deciduous teeth. But for adults, elders, we have from 1 to 8, because we have 16 teeth in the upper jaw and 16 teeth in the lower jaw, including, let's just say in the most cases we have 16, the whole set of permanent teeth. Then from the midline on the right and left quadrant 1 to 8, and from say also from the midline 1 to 8 on left and lower quadrant. I hope by now you have some idea. And the universal system is easy. How it is easy? Because it goes from 1 to 32. For all, from 1 to 32. 32 we have teeth, 32 teeth, 16 in the upper jaw and 16 in the lower jaw. So it goes from the right upper third molar, right? It goes from the right upper third molar and goes like a clockwise for the patient's right. This is patient's right. This is patient's right, and we go a clockwise from 1 third premolar, second premolar, first premolar, second bicuspid or second, here we have second premolar, and then third molar, second molar, first molar, second premolar, first premolar, then we have canine. Later we go like this clockwise. Patient's right starts and patient lower right it ends. This was easy. And on the right side we also have a name. So first is third molar and it ends, upper jaw ends on the 16th teeth, which is third molar on the left side, and same third, it starts from the 17th third molar of the left side of patient lower jaw, and it goes to the lower jaw of the right side to third molar, which is 32. So that's how we remember. But usually in clinical practice, they follow the Palmer system because it's easy to see the left or the right. Okay, so you practice on Palmer notation. But universal notation is used in some part of the world, so you should also know. These two are the systems used for the nomenclature of the teeth. Okay, so we have another A view of this teeth universal system for tooth numbering from 1 to 16 and then 17 to 32. And same for the deciduous teeth or milk teeth or baby teeth, we have A to J, A, B, C, D, E, F to J, and then K, L, M, and O, P, Q, R, S, T. So A to J and then K to T. So for that, we had A to E on the left, A to E on the right, A to E in the right, A to E in the left, and then for upper and lower jaw. But for this, you have A to J. For the universal system, you have A to J and then K to T. So if we summarize it, so this system was Palmer system. And wherever you have, for example, it's closed from the left side, upper left, closed from the right side. Okay, let's make it beautifully. Okay, let's just try to make it beautifully. So we have like this, this. Why I'm taking so much time on this? So that you can remember some of it in the class, and then it becomes better when you revise. Okay, so we have, for example, deciduous teeth. Okay, so just say C here and B here, and then is A and D. So if we talk about here, C, it's closed from the left side. So patient left and is free from the upper side. So upper left quadrant. You're talking about upper left quadrant, and C is the teeth, then central incisor canine, let's just say. And then B is the second tooth for the lower left, and same as is upper from free from upper side, so it's upper, and free from lower side is lower, and it's closed from the right side, so it's right and right. Okay, so it's from A to E on both sides, upper jaw left side, upper quadrant left, upper quadrant right for A to E for the Palmer system. But here we have A to J and then K to T. This is, you need to remember difference between the Palmer and the universal system. Next, so this is overall review of the teeth identification system. Here you can see we have alphanum, numeric system, alphanumeric system, Palmer, and ISO 3950, universal, and paleo and anthropologist, right? And then here we just follow the Palmer system. As you can see, for the permanent teeth and the primary or deciduous teeth, upper right, upper left, upper right, upper left, we have Palmer system. Perfect. And then we follow universal system for the upper jaw and the lower jaw, universal system, and the Palmer system for the lower jaw. So here we have upper left, upper right, lower left, and lower right. Same upper left, lower left for the patient, from the baby, and upper right and lower right for pediatric patient. So that's how you remember, you revise this table. Okay, let's go. Okay, so thank you for this slide. Strive for progress, not for perfection.